Everyone, it's Dee. Thanks for tuning in to Paps and Power Socks. I just wanted to do a bit of a post today unplugged. So hair's not done, my makeup's not done. I'm sitting around my house in my sweatpants and I'm kind of feeling pretty crappy today. A lot of these videos are about cervical cancer and how I came through that early stage cervical cancer and how I'm trying to return to wellness on the other side of that. And it's frustrating because sometimes it feels like you can just get setback after setback after setback, and it is mentally draining. So this has a lot to do with chronic pain, I think, even more than it does cancer. And I think a lot of people feel this way who have chronic pain. You just kind of get stuck into a vortex of, why is this happening to me? Why can't my body just deal with this? So I started getting chronic pain from scar tissue and nerve damage from my radical hysterectomy that I had as part of my cancer treatment. I healed fairly well right after the surgery, but as scar tissue started forming in my body, things started to hurt and movement started to get harder and harder. And then in June of this past year, so 5 months after my surgery, I started having pain. So it would, rather than just feeling stiff and sore, I started actually getting pain. I went to every specialist. First, I went back to my oncology team to make sure that it wasn't cancer related. And once they were confident that it wasn't a reoccurrence, then reoccurrences can often be, signs of reoccurrence can be pelvic pain, soreness in the leg, lymphedema in the limbs, and I had everything pretty much except for the lymphedema, so they just wanted to rule out that it wasn't a reoccurrence. It wasn't cancer, which was fantastic news. So I know there's so many women that do deal with reoccurrences, and my heart goes out to you guys. I was lucky enough that that wasn't the case for me. And the thought was, well, this should go away in the next few weeks, and if it doesn't, then come back, or if it gets worse. Well, it continued to get worse. I went back. They said, well, we'll deal, this doesn't seem cancer related, so we'll take it to your family doctor and they can kind of work you up there. Went to my family doctor. My family doctor sent me to a couple specialists. I had a colonoscopy. I had a bladder scope. I had a CT scan through Cancer Care. They had sent me for one before they sent me to my family doctor, just again to rule out the cancer side of things. And then I went to a pain specialist through Cancer Care. Everybody kind of said, well, it looks like it's nerve damage. So we can't fix that necessarily, but we can try and give you tools to manage. So medication, I was put on 2 nerve medications, one pregabalin and the other being duloxetine. So duloxetine is also an antidepressant, helps with anxiety and nerve pain. Depression and nerve pain go hand in hand. I was really resistant against that at first. I didn't even accepting that I was having mental health issues tied to the pain. But really, once I went on the medication, I realized how much easier it was for me to deal with the pain and to deal with what was going on with my body. So I'm actually pretty grateful about that, and I'll talk about that in another vlog post. So I went to all these specialists. I eventually started doing nerve blocks. So I went to a gynecologist who specializes in nerve blocks. So both internal nerve blocks and external into my abdomen. So they inject lidocaine, and basically what that does is it freezes the nerve. And for whatever reason, with nerve blocks, although on the surface, if you get like a cut and they freeze it, and the sensation will come back in half a day. With an internal nerve block, it lasts for anywhere from a couple weeks to 3 or 4 weeks. So I started doing those in end of November, I guess. And those worked, although they're excruciating for the first couple days. As you can imagine, having your nerves poked with a needle and injected with lidocaine, I found it very excruciating for the first couple days. But then after that, it was getting relief. So I was in December, I started getting relief for about 2 weeks at a time. So I'd get the nerve block, be in a lot of pain for 2 days, and then I'd get about 2 weeks of relief. And then the symptoms would start coming back. And then the third week I would kind of go back to the gynecologist and get another nerve block. So that had been carrying me through. And then right before Christmas, I saw a general surgeon who was kind of the last person on the list to check me out. As far as specialists that my team of doctors, my family doctor, my oncology team thought might be able to help this problem. I'd also been doing physio extensively through all this time, a couple times a week. I was doing physio on an old hip injury that might have been causing referred pain. I was doing pelvic floor physio extensively, and I'll post about pelvic floor physiotherapy. Why every woman should do it. If you've had kids or any sort of gynecological issues. I'll post that in another video, but I've been going to that extensively, and the physiotherapist that I've been seeing had mentioned that it could be, I had a hernia that I've had for like 10 years from an old injury, and it's never bothered me, but they thought that maybe with the scar tissue forming and the, everything shifting because so much is removed and your organs shift around in your pelvis, that could be causing problems. Maybe something got stuck up in there. So they said, you should check with the general surgeon. So I talked to my family doctor about it. Family doctor said, well, we don't think, everybody kind of said, well, it doesn't seem like it fits with hernia pain. So it doesn't really seem like that would fit it. And if it never bothered you before, it probably wouldn't bother you now. So anyways, this was kind of the last person. Didn't really expect much from that appointment, but went in there and the doctor said, yeah, I think this actually might be causing your pain. So I went for surgery at the beginning of January and had that hernia fixed, so about 4 weeks ago. And the pain's been, after recovering from that surgery, the pain has been way less, like 80% less. So I'm getting ready to go back to work soon, in the next couple weeks, and I'm really excited about that. And then over the weekend, all of a sudden, this incision site that's like 3 weeks old and healing great, I just had it checked last week at a recheck, and all of a sudden it's infected and it's sore and it's swollen, and I have to go back to the doctor again. And I feel like when you're dealing with chronic pain, when something like this happens, it just kicks you in the gut. And you just feel like, I just feel today like I'm never gonna get over this stupid surgery. And I blame the radical hysterectomy because everything started happening after that, and it gets really hard to deal with. So chronic pain, a lot of people live with it and try to go about their day-to-day life. And I was doing that until September, when I decided to take time off work. And that was an incredibly, incredibly hard decision. Taking time off work, I love my job so much. And taking time off work, it just feels like, although I know it's good for me and my body needed it, it's one of those things where you just feel like you're failing. But my family was incredibly supportive. My work was incredibly supportive. Everybody's told me, don't worry about it. Are you crazy? Take the time you need. Take all the time you need. If you need more time, take time that you need. Like, they're just so incredibly supportive. Even when I've had to extend that time now 2 times. So that's been amazing. They're so amazing. And so it's not like I should really be worrying about it, but you worry about it anyways. But a lot of people have to work through that pain, and I did for a long time, but it just gets to the point where you can't deal with it and you can't really put on that happy face. Because what I would do is I'd be in pain, I'd go to work, I'd put on a smile, you know, talk to people, do the platitudes. Oh, hey, how are you? I'm great. Things are great. Kids are great. When really on the inside, you just feel like it's not great. And then you go to your car and you can, you know, hardly get into your car or get out of your car. When you get home, you're just exhausted because it's mentally draining. It's exhausting on your body to kind of just put up with that pain. And so you just get home and you just crash on the couch, and then it's hard to be a good mom and a good wife and all of those things. So yeah, I don't know where I was going with this video. I think I might have to redo it. I'm not quite very happy with where I think I went off on a tangent. But anyways, chronic pain it's tough, and when little things like this infection that I'm dealing with right now come up, you just feel like it's never gonna get better. I just have to keep telling myself it will get better. It's just baby steps, and try not to rush things and be kind to your body. Let yourself heal. Give yourself permission to heal.